Hi, I'm Dr. Melissa Seeley Morgan. I'm on staff at Dekalb Medical Center as an interventional radiologist. Usually patients come in for a compression fracture because the back pain is so severe, and this typically develops immediately after the compression fracture. Less likely, patients can develop increasing pain, and then they come to us as something that they've done a few days earlier, and the pain is intolerable. The spine is not just one big bone. It's got vertebral bodies right here, and it's got the disc, and this is the cushion between the bones. And what we're talking about here is fractures that involve the bone. And we've got a lot of little pieces of bone in there that rub together, and that's what causes the pain. And we'll do a series of different exams to diagnose the compression fracture. The first component of any medical exam is a physical and a medical history. And we'll look at the patient, we'll look for point tenderness in their back. We'll also complete some x-rays of their back, and that typically shows us compression fractures. The next step is to do an MRI scan, and an MRI is very important because it determines the acuity. How new is this fracture? So we'll look at the MRI scan, and that'll also tell us if patients have compression fractures that are old, that maybe they don't even remember doing. Those are not fractures that we can treat, and they may have a compression fracture somewhere else that didn't show up as obvious on the plain films. Traditionally, compression fractures were treated conservatively. The patient would be put in a brace, and they would wear that for some time, as the pain typically takes about 3 to 6 months to resolve. Kyphoplasty reduces the risk of additional bone fractures by restoring height to that vertebral body. It is minimally invasive. It stabilizes the bone fragments, and it provides instant relief for the patients. Additionally, it restores the architecture of the bone. And you can imagine that we have the square vertebral body that is now compressed. Once we restore that height, you don't develop the bowing of the back that we see so often in elderly patients. The way that this procedure is performed is we place the patient on the x-ray table, and this is in a room that is sterile, like an operating room. And under x-ray guidance, we place a bone needle into the vertebral body through the back. We'll put another one through the other side of the vertebral body through the back. These are hollow. We take out the inside and we put a balloon through there, and we inflate the balloon under x-ray guidance. We do that same procedure on the other side, and then we take the balloons out. Then we place through those same bone needles cement, and then we wait for that to harden, which takes just a few minutes, and then everything comes out. And at that point, the procedure is done. The patients feel very, very comfortable during the procedure. They also, immediately after the procedure, feel significant relief of their back pain. The actual procedure takes about 15 minutes. I usually watch my patients for about 2 hours after the procedure, and then they're welcome to go home, unless there's something else that's keeping them in the hospital. This is a procedure where they're probably back to their activities of daily living within a day or two. At Dekalb Medical, we understand the urgency of back pain. We have systems in place so that patients can get in, the diagnosis made, and treatment performed, and get the patients back to their lives.